Hi, my name is Dr. Tom O'Loughlin. I'm a staff physician at the San Joaquin Valley Rehabilitation Hospital. And I was asked by the hospital to provide a little bit of education about immunization and the COVID pandemic immunization, of course, in particular. And so I thought I would lead off just by talking a little bit about our experience here at San Joaquin Valley Rehab Hospital, which we've had a considerable amount of. And I can easily say that this past year has been the most challenging clinical year of my life as a result of this pandemic. And I'm very proud of San Joaquin Rehab Hospital for how they've managed to get through this past year and the efforts on the part of the staff and the administration to not only protect the patients and the staff as well, but to assist the families with what they've been going through. The rehabilitation hospital is, of course, directed at the care of individuals who are substantially disabled and require a multidisciplinary rehabilitation team effort in order to get back to the community. And it's been exceedingly challenging to help these folks under the restrictions that we've had to face and the efforts that have had to be put in order to protect ourselves, the patients, and the community with regard to utilization of infection control devices, personal protective gear, etc., but also in supporting families who've been restricted from visitation, and that's put an enormous strain on the staff and the patients and families, and it's been a very difficult thing to live through. And it's required an extra special effort on the part of a team that is ordinarily very caring, very patient and understanding, and it's stretched us to our limits. And the hospital has been full and has taken on even non-traditional rehab cases in order to offload the overflow from acute care hospitals. And so we've been extraordinarily busy, on top of having to go a little extra to try and help families get through this, as well as ourselves. And I bring that forth and emphasize that because I know that my coworkers here at San Joaquin Rehab and myself and those in the healthcare field have profoundly appreciated the damaging effects of this pandemic. And it has served to make us maybe a little zealous about the idea of masking and protecting out the community. And so we first and foremost want to emphasize that when you see the types of things that we've seen here, you want to go the extra mile to try and limit how much damage has been done. And we have had an experience with a number of post-COVID pneumonia patients who have been so weakened by 2 or 3 months of acute hospitalization, sometimes on ventilators for 6-8 weeks and some longer, who cannot get back up and get back on their feet, that have to come in for strengthening, reconditioning, and struggle to get from the bed to the wheelchair or from the wheelchair to the toilet, and have to have their oxygen levels turned up in order to do so. And you watch their oxygen levels plummet while they're struggling. It has a very deep effect on you. And I would like to just convey that because a lot of those who are not taking the vaccination or the protection seriously don't have that experience, and we do. And when you've had it and you see what can happen to people as a result of this virus, it has a very profound effect on you. So we urge continued caution. Now, just a word about the immunization, and this is what's getting us out of this trouble. This virus, we haven't seen anything quite like it since the pandemic of 2018, the Spanish flu. This has been the most virulent bug we have seen in my entire lifetime. And it has wrought havoc, and it's so unpredictable. We're learning all the time about this virus, and in that there may be some silver lining to it because we're learning tons as we go, including the rehabilitation from having such a severe illness, and what happens to folks and what the long-term consequences are of what the virus does to one's body. And we are at a juncture where we're starting to get on top of this with the immunization. And I'll just briefly go over the vaccines that are available now. There's three main ones: the Pfizer, the Moderna, and the Johnson & Johnson vaccines. The first two are very similar. They're mRNA vaccines that deliver messenger RNA. And the third is a viral vector. It's an adenovirus with portions of the spike protein. That's the surface protein on the coronavirus that infects. And that's what we become immunized to. Those vaccines have all been proven to be extremely effective. Fortunately, they're all in the 95 to 99% range of effectiveness. And some are reporting in vast areas 100% effectiveness in preventing death, 90% to 95% effective in preventing hospitalization. So those are just hugely successful vaccines, and we strongly encourage people to get them. And the number one question that I have gotten around here in the hospital and from my friends and family is, what are the potential risks and side effect problems of the vaccine itself? And fortunately, that also has turned out to be very mild for the most part. There are the 1 in a million cases of anaphylaxis responses that could potentially result in death. It's a collapse of the circulation. And those tend to be people who have had a similar experience or have multiple allergies. And the folks that have the vast majority of responses to the vaccine are mild fever, chills, a slight cough for a day or two, goes away. And that's the usual experience, and maybe some soreness at the injection site goes away in a few days. Excuse me. The safety profile, therefore, has been extremely good. We had experience with the vaccines that were first developed in 2003 and 2012, when previous coronavirus epidemics that didn't become pandemics emerged, and we had those similar numbers. We had a feeling that would be the same response now, but they're even better than the vaccines that were previously developed, and they've been built upon so that they're much better. So I've told my friends, family, and coworkers, don't hesitate to get it if you don't have a problem with either multiple allergies or pre-existing conditions that might render you a little more susceptible to a stronger reaction. And that's something that, of course, you'd want to discuss with your own private physician. That having been said, these vaccines are extraordinarily safe, effective, and they are from excellent companies. I've heard there's been lots of misinformation and rumors about problems with them, and there's been questions about vaccinations in the past with the usual childhood vaccines, the Tdaps, rubella, and the polio vaccines. And while there have been distant problems with those, they have all proven to be also safe and effective. And the rumors about them causing, for instance, ADD just have not been founded. And so a lot of the misinformation that's been spread around is just simply untrue. We're getting on top of this. And the big question becomes, when do we reach herd immunity? Herd immunity is that point in time in which enough of the population are immunized or protected against the virus that the virus can no longer spread and will fizzle out. And that herd immunity factor is nebulous. It's somewhere in the range of 50 to 70%. In the case of this virus, which is much more virulent, it's 70 to 90%, we think is where we need to be. And that is probably no more than a couple months away. And I know that our president has set a goal for July 4th as being when we'll finally be able to be free of all the restrictions, can move about freely without restrictions, without masks and so forth. There'll be cautions about that. Even if you're immunized, there is some much smaller possibility of spreading the virus, and there'll still be those who are yet immunized. So we urge continued caution, and I'd like to emphasize the president's recent statement about doubling down on protection. Now's the time for us to get even more stringent rather than to loosen up too quickly. And it's been our experience over the course of the past year that every time there's been a loosening of restrictions, especially during holidays where there are large gatherings, after a plateau in the virus, there is then a surge. We're now going on about our fourth surge. And so we would like to keep this one to a minimum. And the better that we do at that, along with the immunization, the closer we'll be to herd immunity, and the closer we'll be to freedom once again. So those are my main thoughts. There's many questions about the duration of the immunity. How long will it take for us to, before we might need a booster shot, if ever? Those questions are yet to be answered. Clearly, it looks like we've got 8 to 9 months of immunity from one immunization, 2 immunizations, and probably longer. Most likely it'll be a 2 to 3 year period where most people will be fairly well protected. But that still remains to be seen. There's a possibility that this could confer a lifetime of immunity. That still needs to be seen. So it's an ever-changing environment, and this is not the only virus out there, unfortunately. And climactic change and some of the strength of the storms that are around are mixing the bugs up even at a faster and faster rate. We are seeing other types of viruses that are emerging, affecting the central nervous system. Those are folks that come in here with viral encephalitis that are non-COVID. So we still urge caution and protection. So that's a little bit about immunization and the situation with COVID as we stand today. Thank you very much for listening.